Hello everyone, it's Dr. Dave. Hopefully you're all doing well, enjoying your week, making the most of things and staying healthy. Coming at you on behalf of the Toronto Neck and Back Pain Clinic with your daily health update for Thursday, August 5th, 2021. Going to look at 6 areas of health and wellness news and information somewhere around this video. You can read through all 6 areas. If you'd like a copy or you have any questions, you can DM us on social, send us an email, or give us a call here at the clinic. Always happy to help you out. Not going to treat, diagnose, prevent, or cure any illness or disease with our time together today. However, you just never know what that wonderful body of yours is capable of when you give it a great environment to do what it's designed to do, and that's to take care of you and help create those great experiences you want every day. And some of the information that we share will hopefully stimulate some of your own thoughts and actions today to keep taking care of that body of yours so that it will provide you with an opportunity to do what you need and want to do every day. All right, so there is an article here from the Pediatric Infection Disease Journal, August 2021, that if it's of interest to you, you can look up and read about. It talks about maternal mental disorders and how that may increase risks for young children. So a connection between mom's mental health and the health and wellness of the children. You're welcome to read about that. Cardiovascular Research, June 2021, talks about heart-healthy food choices. A comprehensive research review on eating habits and heart disease has revealed consistent evidence that a diet featuring more servings of whole grains, fruits, veggies, legumes, and nuts, and less salt and less animal proteins is associated with a reduced risk for heart disease. We've heard it before, we know that that's the case, and today it's an opportunity to go and make it happen, ensure that it plays out that way. So some good nutrition, some good food choices today, if you will. And along with that nutrition, we want to get moving in a healthy way as well. The Journal of Applied Physiology, July 2021, talks about aerobic exercise benefits, and not just for the heart and lungs, but also for our cognitive function. Older adults with mild cognitive impairment who met physical activity guidelines of 150 minutes of moderate to vigorous exercise a week for 1 year experienced improved cardiorespiratory fitness, cerebral blood flow, memory, and executive function skills. The findings suggest that aerobic exercise training has the potential to preserve cognitive function and possibly delay or reduce the risk for dementia. So not just about how you look, a lot about how you feel, but also about ensuring your body continues to function well on all levels, all the organs, glands, and blood vessels, including our noggin, our good old brain, for that cognitive function. And along with that, in case you were curious, the Nature Human Behavior Report, July 2021, talks about smartphone use and how it does not reduce intelligence. While it's often suspected that increased use of electronic devices is detrimental to the brain, the University of Cincinnati's social behavioral expert notes that smartphones and digital technology seem to do instead is to change the ways in which we engage our biological cognitive abilities. These changes are actually cognitively beneficial, so despite the headlines, there's no scientific evidence that shows that smartphones and digital technology harm our biological cognitive abilities. Interesting aspect there. Maybe all of that technology really does make our world a better place. We'll see. Brigham Health, July 2021, talks about reducing osteoporosis risk. Experts note that participating in weight-bearing exercise, maintaining healthy vitamin D and calcium levels, not smoking, and avoiding excessive alcohol consumption can reduce the risk for osteoporosis. Take care of those bones of yours, especially if you're a teenage or young adult that's female. You want to build up that peak bone density by your late 20s, age 30, and that way you'll have less loss over time, hopefully, because you built it up enough. And that's when our peak bone density occurs, is late 20s into our 30s. Finally, the Journal of Manipulative Physiological Therapeutics, May 2021, has an interesting perspective on GERD, gastroesophageal reflux disease, and rehabilitation techniques that could benefit people who suffer from that form of heartburn. A study that included 54 adult patients with gastroesophageal reflux disease found that the combination of cervical manual traction and traction on the neck and trunk stabilization for the mid-back and upper back improve function in the upper and lower esophageal sphincter muscles, which is often impaired in GERD patients. The findings suggest that such treatments could play a role in the management of esophageal reflux disease, but further research is needed. So there is this connection between how well our body is physically functioning and the function of the organs, glands, and blood vessels. And in fact, chiropractic for a long time has noted a connection between the health and function of the spine, which houses your nervous system, as well as the function of the organs, glands, and blood vessels. So not just good treatment for how you physically feel, but also for, again, overall function in the body, including that digestive system, that gastrointestinal tract. So there you have it, your daily health update for Thursday. Lots of good tips and suggestions to motivate you to keep giving your body a great environment in which to thrive. Keep choosing good things to put into it. Keep choosing good things to do with it. And it will, in return, give you a good experience every day to live that life you'd like to live. We'll be back tomorrow with a written format for you of the daily health update to send you into the weekend. Enjoy yourself, make the most of the summer, and we'll catch up with you next week, maybe with written formats next week. We might be taking a little break ourselves for the summer, but we'll try and get you those if we can. If not, we'll follow up with you the week after. Keep some good momentum going with our daily health updates and your health and wellness. All the best. Take care. We'll talk soon.